Hello everyone, now I'll discuss about the gross features of ureter. The section includes the course of the ureter, its parts and relations, its blood supply and ureteric calculus. Then in this figure what you're seeing, this is the posterior abdominal wall. Okay, this is the superiorly, this is the inferior, there is the anterior view. Superiorly you can see this is the diaphragm is there, then posterior abdominal wall muscles are there, medial most will get, this is the psoas major, lateral to that this one is the quadratus lumborum, then see this is the iliac crest, will get this iliacus muscle, then medially that blue one, that is the, this is the inferior vena cava, then will get, this is the abdominal aorta, then this abdominal aorta divides into, this is the right, so this is the right side, this is the left, this is the left common iliac artery. Then this common iliac divides into external iliac and internal iliac arteries. This part where this common iliac divides, that part is this region, this is the pelvic brim. Here we'll get this, the pelvic brim. Then additional to that, you can see this is the external iliac vein. Here we'll get this internal iliac vein. This external iliac, internal iliac forms this common iliac of this left side and this right side that joins to form, this is the inferior vena cava. You can see there the ureter there. See the hilum of the kidney. See this is the hilum of the kidney. So this is the left kidney. So anteriorly structure present in the hilum, that is the renal vein. Posterior to that we'll get, this is the red one, that is the renal artery. Then structure is going down through this lower aspect. So this one, this yellow color structure, that is the ureter. So this is the left ureter. Here this one is the right ureter. Then so ureter, it is a tubulomuscular structure, okay, which extends from this hilum of the kidney towards this base of the bladder, okay, towards this base of the bladder. Then it pierces the wall, bladder wall, and opens into the lateral angles of the trigone of the bladder. Okay, its course is through this abdomen, then crosses the pelvic brim, and its course again it goes going to this pelvic cavity. Okay. Yes. So in this figure what you are seeing, this one is the coronal section of the kidney. See this is the upper pole, this is the lower pole, this part is the hilum, this border, this is the medial border, this one is the lateral border. We know the function of the kidney, that is the main function is the filtration of the blood. So the filtrate undergoes a series of reabsorption and exudation throughout the length of convoluted tubules. You can see the convoluted tubules here, that is the proximal and distal convoluted tubules there in the cortex. Then the resulting liquid, okay, passes through the collecting tubules, which enters to the collecting duct. Tubules, ducts will be there in this pyramid. Then enters through this papillary ducts, then opens into this minor calyx. This is the minor calyx. These minor calyx joins to form, this one is the major calyx. Then this major calyx, this is the major calyx, forms this, that is the pelvis. This is the renal pelvis. Okay. So you can see this is the minor calyx. Minor calyx forms this major calyx. This major calyx forms this one, that is the renal pelvis. Okay. See, the renal pelvis extends from this hilum of the kidney to this lower pole, to the level of the lower pole of the kidney. Then it becomes narrows. Then it narrows and forms, continues as the ureter. Okay. Then coming to the course of the ureter. Here, this is also this posterior abdominal wall. See, this is the right kidney. So this is the left kidney. This is the right ureter. This is the left ureter, can see. Here, this is the lower pole. So from the hilum to the level of this lower pole, that part forms the pelvis of the ureter. Okay, the ureter gets narrowed here at this uretero-pelvic junction. This junction here between this pelvis and the ureter, that junction, the ureter gets narrows, shows a constriction there that forms the uretero-pelvic junction. This is the uretero-pelvic junction. Okay, then see the ureter, it is going to this anterior of this psoas major muscle, somewhat downwards medially it is going, like this is going. See this area, this forms the pelvic brim. This part is the pelvic brim. Then it crosses this pelvic brim, then enters into this pelvic cavity, where it crosses this bifurcation of this common iliac till that is the level of the pelvic brim. Behind that is the sacroiliac joint is there. Then from this uretero-pelvic junction to this pelvic brim, this part is the abdominal part of this ureter. That is the abdominal part of the ureter. From this pelvic brim towards this bladder wall, which is going to pierce the bladder wall posteriorly, is through the base. So that area here, this is the pelvic part of the ureter. So it can be divided mainly into three parts. One is the pelvis of the ureter, abdominal part, and the pelvic part. Then see, coming to this abdominal part, you can see this is the uretero-pelvic junction, this is the pelvic brim. Here is the pelvic brim. Okay, see, some vessels are crossing the ureter in the anteriorly in this abdominal part. These are the gonadal vessels. These are the gonadal vessels. Okay, in case of this is a female pelvis, you can see this, the uterus there. So there is the ovarian artery and ovarian vein. In males, there is the testicular artery and testicular vein. We can use the term that is the gonadal vessels. Okay. So that about this course of the ureter. Then it shows constrictions at 3 levels here. So this is the renal pelvis from this kidney. See here, you can see this one is the pelvic ureteric junction, that is the pelvic ureteric junction, where the renal pelvis narrows and forms this ureter proper, the abdominal part, that is called the ureter proper. So here it's shows constriction. Actually the diameter of the ureter, that is 3 mm. Its length is 25 centimeter, that is 10 inches. Upper part, that is till the level of this pelvic brim, that is 5 inches. The lower part, that is from the pelvic brim to this bladder wall, that is also 5 inches. Total, that is the 10 inches, that is 25 centimeter. Okay. Diameter, that is 3 mm. Then, so you can see constriction at the pelvic ureteric junction. See, this is the abdominal aorta, divides into this common iliac arteries, that is the right and left common iliac arteries. Okay, then where it crosses the pelvic brim, there it's also the ureter is shows constriction. Okay, it crosses the pelvic brim. Then where it pierces the bladder wall, okay, that junction is called the uretrovesical junction. Ureter vesicle relates to the urinary bladder, that is the where it pierces the bladder wall, that there also it shows constrictions. Okay, that is called that is at the level of this uretrovesical junction. Okay, these are the constrictions of this ureter. At its the pelvic ureteric junction, where it crosses the pelvic brim, then at the level of this uretrovesical junction. Okay. Then these constrictions prevents backflow of the urine. Okay. Moreover, the carcinoma starts from these areas, and also this ureteric calculus or the kidney stones gets stuck into these areas. okay, because that area shows constrictions. If it is stone, if it is more than 3 mm size, okay, gets stuck there. That about the constrictions. Then coming to the relations of each parts. Okay, here this is a closer view of this right and left kidney. So right side, this is the left, this is the anterior view. Okay, we have removed the viscera, seen the posterior abdominal wall. That is mainly the kidney with this vessels. That is the inferior vena cava. This is the abdominal aorta. Here, this is the pelvis of the ureter. Okay, you can see anterior to the renal pelvis, there is the renal vein is there. See the renal vein. Then you can see this is the renal artery. This is the renal vein. This is the renal artery. It lies anteriorly. Then posteriorly, see the posteriorly, here this muscle, this one, that is the psoas major. You can see the muscle here, that is the psoas major muscle. Additional to that, anteriorly, here you can see this is the right kidney. Here the part of this left kidney can see. This one, here you can see this is the inferior vena cava there, inferior vena cava. Then abdominal aorta can see here, abdominal aorta, that is the celiac trunk. See, this is the duodenum. This is the first part, second part, third part. This is the third part. This is the fourth part. Then this one continues as this, that is the jejunum. See, the right kidney anteriorly near to hilum, that is the second part of the duodenum. Additional to the renal vessels, there is the right side, there is the second part of the duodenum. On the left side, say, there is the tail of the pancreas. See, this is the kidney. The left side, there is the tail of the pancreas. Posteriorly, there is the psoas major muscle. Here. Then, abdominal part relations. See, this is the uretero-pelvic junction. This is the pelvic brim. So, this part, this one, that forms the abdominal part. Okay. Then, see, it lies over the psoas major muscle. This is the psoas major muscle. Then also, along with that posterior of the ureter, there is one nerve is there, that is the genitofemoral nerve. That is the genitofemoral nerve. Okay, genitofemoral nerve. Okay. Then, anterior to that ureter, the anterior relations, here you can see this is the right gonadal vessels of both sides, gonadal vessels. Then in this figure you can see the gonadal vessels. Here you can see this is the kidney, this is the right kidney. See, here you can see the part of this is the left kidney. Okay, see, this is the second part of the duodenum. This is the third part. This is the third part. So, the right side, the ureter anteriorly gets caused by this third part of this duodenum. Then, see, this is the superior mesenteric artery. Superior mesenteric. This one is the inferior mesenteric artery. It's providing colic branches. That is the right colic artery, ileocolic branch. Left side, there is the left colic artery. So, it is providing colic branches. So, right side anteriorly along with this third part of the duodenum, there is the ileocolic and right colic arteries. Okay. Then here the lower there is the terminal part. See, this is the ureter. You can see this, the ureter. See this one, this structure. This is the ureter. This one, this is the ureter. So, it's crossed by this terminal part of the ileum on the right side. Then see the left side, this is the colic branches. Okay, that is the colic branches of the inferior mesenteric artery is there. Then here, this is the cecum, ascending colon, transverse, descending, then sigmoid colon. So, sigmoid colon and sigmoid mesocolon is there anterior to this ureter on the left side. This forms the anterior relations. Posteriorly, psoas major and this genitofemoral nerve. Then, coming to the pelvic part. So, pelvic part extends from this, there is the, extends from this pelvic brim. Pelvic brim will be there, then urinary bladder, that is towards this base of the bladder. Okay. Then see here, this is the hip bone. See, this is the anterior aspect, this is the posterior aspect. So this is the left side hip bone. Okay, here this one, this is the arcuate line that forms the pelvic brim. Then it's entering this region. This is the lesser pelvis. Okay, lesser pelvis. Okay, so the ureter, okay, is going downwards. Okay, in the pelvis it runs downwards, then backwards and laterally to this lateral pelvic wall, then reaches at the level of this ischial spine. See, this is the ischial spine, and anterior to this greater sciatic notch. This is the greater sciatic notch. At the level of this ischial spine, it changes the direction. Okay, it goes anteromedially, making a transverse plane. Actually, moving in relates to a transverse plane. This is the transverse plane. Moving in relates to a transverse plane, that is horizontally, then towards this bladder. Okay, towards this bladder. Then it pierces this bladder wall, then opens into this lateral angles of the trigone of the bladder as ureteric orifice, as this ureteric orifice here. Okay. So that's the course of this pelvic part. Okay. So from this, where it crosses this pelvic brim, okay, you can see this is the pelvic brim. Here again, this forms the pelvic brim. There you can see this is the common iliac, divides into external iliac and internal iliac artery. This is pelvic brim. From this level to this ischial spine, that forms the vertical part of the ureter. Okay, that is the vertical part. From the ischial spine to this bladder wall, this one forms, this is the oblique part of the ureter. Then in the bladder wall, okay, it's going to the bladder wall, that one is the intravesical part. Here inside, this is the intravesical part of the pelvic parts. These are the three divisions of this pelvic part. Okay. Then relations of this pelvic part of the ureter. Here you can see this is the pelvic brim. So it crosses abdomen, it crosses this pelvic brim. Okay, so this vertical part posteriorly will get, this is the internal iliac vessels are there. Then there is this one, that is the lumbosacral trunk. Here you can see this is the nerve plexus. This is the lumbosacral trunk is there. Then here, the joint here, this is behind, that is the sacroiliac joint is there. These forms the posterior relations, okay, which lies behind this ureter in the pelvic part. Okay. Then that is the pelvic part, that is the vertical part, posterior relations. Then in this figure, you are seeing this is the sagittal view. This is the pubic symphysis. This is the anterior. This is the sacrum. This forms posterior. Okay, you can see this is the bladder, the prostate. This is the prostate. Okay, so this is the male pelvis. Okay, see, this is the common iliac artery. This is the external iliac. This one is the internal iliac. Then you can see this is the external iliac vein. This is the internal iliac vein. Okay, then here you can see this is the ureter. See the ureter crossing the pelvic brim. Then after this goes, this is the vertical part of this ureter and relates to the lateral pelvic wall. So laterally it relates to One muscle is here. You can see that is red color structure. This pale red color, that is the obturator internus with the obturator fascia is there. Additional to that, you can see the important one nerve is there. This is the obturator nerve. Along with the vessels there, this is the obturator vessels. Then here we'll get the superior vesical artery. This is the superior vesical artery. Here it gets, this is the inferior vesical artery. This forms the lateral relations. This forms the lateral relations of this vertical part of the ureter. Then here in females, okay, this oblique part, okay, see here, this is the right common iliac, this is the internal iliac, this one is the external iliac. You can see this is the ureter. See, the ureter is going, okay, through this broad ligament, okay, then towards this base of the bladder is going. Then in the broad ligament, okay, you can see this one artery here. This is the uterine artery. This one is the uterine artery. It crosses the ureter anteriorly from lateral to medial. From lateral to medial. Okay, that forms the one main relation in this oblique part of the pelvic part of this ureter. Okay, this uterine artery crosses anteriorly to the ureter from lateral to medial. Then here, this is the prostate. So in males, you can see this is the urinary bladder. This is the base of the urinary bladder. Prostate, that is the posterior of the prostate. This is the view from behind. Okay, so you can see this is the ureter. This is the ureter. See, the ductus deferens or the vas deferens crosses the ureter superiorly. Ductus deferens crosses, okay, is going superior to this ureter. Then seminal vesicles lies below and behind to the ureter. Okay, these are the relations of this oblique part. Okay, oblique part. Okay. Additional to that, here in this figure, here we'll get the laterally in females, there it relates to the ovarian fossa. Additional to this obturator internus, and this branches from this internal iliac artery. Females, there is also the ovarian fossa where this ovary lodges. Okay, that also comes under the lateral relation. Yes. Then that's about this the cause and the relations. Then the arterial supply. Okay, so this blood supply of the ureter, that is here you can see the arteries supplying are the branches, ureteric branches of this renal artery, branches from this gonadal artery. Then from here you can see this is from this superior vesicle, branches from the superior vesicle. Then here in case of the males, branches from the uterine artery, vaginal artery. Then also the branches from this inferior vesical artery is providing branches to this ureter. Then venous drainage into those corresponding veins. Okay, mainly there is the towards this renal veins. There is the right and left gonadal veins are there. Here you can see this the left gonadal vein drains into this left renal vein. Right gonadal vein is there, that one drains into this inferior vena cava. Okay, it's a venous drainage. Then lymphatic drainage, that one is to this lateral aortic nodes and to the external and internal iliac nodes. Nerve supply, this is the sympathetic, that is derived from the T12 to L1 segments, okay, through this aortic and the inferior hypogastric plexus. Parasympathetic is derived from the S2 to S4 segments through this pelvic splanchnic nerves. Okay. Then Here you can see this is the ureteric calculus. So this ureteric calculus or the kidney stone is the presence of a solid stone in the urinary tract. It's formed from the minerals within the present in the urine. They can obstruct the urinary flow, causing symptoms that is the renal colic, okay, that is the severe loin pain which radiates into the groin. Then this hematuria, blood in the urine. Then this dysuria frequencies. Then this one that is the strangere, which is the painful urinations. Okay, we have seen the three locations of the ureter where the ureter is narrowest. Okay, that is the three constrictions we have seen. One is at this is uretropelvic junction, pelvic brim, and the vesico-ureteric junction. So this urinary stones can stuck into those areas. Okay, and also the investigation for the suspect of this ureteric calculus is mainly through the CT scan of the kidney, ureter, and bladder, and also with the help of this plain urological radiography. What you're seeing, this is the plain urological radiography. Here you can see this is the ureteric calculus is there on the left side. Okay, left ureter, there is a calculus, you can see. That's all about this ureteric calculus. Yes. Then now you can answer this, okay, that is the cause and the relations of the ureter, which are the constrictions of the ureter. What is hydroureteronephrosis? Okay. Thank you.